good day, everyone. This is Dr. Jamie Marich, Director of the Institute for Creative Mindfulness, and I'm being joined by my colleague, Amber Stiles-Bodnar, who is the Director of Blue Star Family Counseling in Cortland, Ohio, also the owner of Amber Stiles-Bodnar Consulting, and she is a senior faculty member with the Institute for Creative Mindfulness, and I affectionately refer to her as our team neuroscience expert. Hi, Amber.
Hi, and Ambular.
And Ambular. That's my affectionate nickname for her because we go way back.
Yeah.
I like to say that Amber and I survived the trenches of community mental health together.
Mm-hmm.
So something we want to talk about today is an issue we've presented on before. We've seen this question come up a lot in the networking groups, and it's probably one of the top 3 most frequently asked questions we get as consultants, which is, what speed of stimulation do you use in phase 5? In phase 5 installation? Do you go slow? Do you go fast? So Amber, I will put you right on the spot. What speed do I use in phase 5?
Mm-hmm. Phase 5 is fast.
Okay.
Always fast.
Phase 5 is fast, always
Phase
fast. Or how I sometimes clarify it is phase 5 is processing speed.
Right.
Because I do highlight in some of my teaching that fast is a relative term, slow is a relative term. What is slow for one person may be fast for the other. But I think any EMDR therapist listening to this would realize there's a difference between the slower speeds we may use for phase 2, which is the preparation or resourcing. And then we work up the speed when we're in phases 4 through 6 specifically, which are the reprocessing phases. And I think that's a key thing I want people to grasp, especially as we talk about standard protocol, that phases 4 through 6 are reprocessing phases.
Right.
So Amber, help us understand a little bit more of what that means.
Okay. So the idea is, and when we're talking about fast, some people have kind of put out there too that it's as fast as they can tolerate. And so that tolerability is going to be depending on the person, which is why their slow might be a little bit different and slow versus their fast. But like you said, there's a distinction between what is slow and what is fast. So the idea of I think the best way to look at this is to understand what it is we're attempting to achieve inside of phase 5 work. Yes. So like you said, 4, 5, and 6 are all reprocessing phases of EMDR. Inside of reprocessing then, once someone has a SUDS of 0 in phase 4 and the desensitization phase has finished, we're moving into phase 5 installation. So the way I've always explained it is we're taking the positive belief that's now been that the person had wanted to believe, and we're placing it over the top of a trauma memory, right? And we're checking to see how true that is. Once true, right, then what you're doing is you're doing reprocessing with that. In other words, you're attempting to hold a positive belief together with a trauma memory in a tornado, not in calmness, right? In calmness, I can get anything to stick together. That's the point, right? But inside of reprocessing, we're seeing if it can stick together, a positive belief about yourself inside of a trauma memory in a storm. The storm is the fast bilateral. It's the activation. People will talk about, I activated the client up. Exactly. We activate them up and then we do the fast bilaterals to maintain activation, right? That's what we want. And that's what's happening in phase 5. Is the activation being maintained through the fast bilaterals to see if the positive belief can stay held together with the trauma memory.
And in doing that, other positive material may emerge, is my experience.
Absolutely. Other positive, larger connections. So, hi, Misty May.
Misty's joining us, yes.
So, other positive material may emerge, which would be wonderful. You know what I mean? That's great. At the same time, if other distressing material emerges, that's okay too. That's the point. The point of EMDR inside of installation is the generalizability. That's what that phase is all about, right? And so the idea is that if other material starts to come up, then we're using the fast speed in that target memory with that work to actually work through those things. And that's what we call the generalizable effect of EMDR, right? Sure. So people will start talking about, other times when, or other aspects when, and I agree. So this is where I think a lot of confusion comes in too. There's gray area and clinical judgment about where I bring it back to the target memory and where I bring it back to what I'm working on versus how much generalizability I allow you know what I mean,
Yes.
from a clinical perspective. And that's probably that's a whole nother,
Yes.
a whole nother kind of area. But the idea is that that's what you want to have happen.
Beautifully explained. Now, to be clear, this
Mhm.
is one of the greatest sources of confusion I have countered in 15 years in the EMDR community, right?
I
And
would agree.
I will say, even within our curriculum, because we're a training program, Institute for
Sure.
Creative Mindfulness, we're very clear in our materials, fast, bilateral, fast in phase 5. And I have still had consultees of ours say, well, remind me again, is it slow or fast in phase 5?
Right.
And we're very clear.
Right.
And go ahead.
Yeah, and I would just say I've even had we have it written into our script even, and
Yes.
I've had people come back to me as a trainer, you know, with ICM and say, "Well, Amber, when you said that we go slow," and I'm like, "No, I never said we go slow during." I know, believe me, I know I have never said that. So somewhere somebody has interpreted this idea of something being positive, right?
Right.
Or something being adaptive, that when that happens, I have an example too, we slow it down to
Mm-hmm.
strengthen this adaptive response. And what I try to explain is that adaptive isn't necessarily something you want to strengthen. Let me give you an example.
Go ahead.
So if I'm doing a trauma memory target and I come to an adaptive response of I got myself out of there, right? And so as a therapist, are you going to then slow down? Amber got herself out of there. Is that resourceful, right? Or was it adaptive inside of my response, inside of my reprocessing of a trauma memory, right? What if I have a larger system of avoiding my problems? You're going to want to strengthen a concept of Amber tries to get herself out of there. No, it's not a resource. It's adaptive inside of the reprocessing, but it's not necessarily resourceful, which
Right.
is what phase 2 work is, which is what's slow.
So to piggyback on that, this is my contention on where the confusion arises. That yes,
Yeah.
phase 2, technically called preparation, but we've largely taken to calling it resourcing,
Mhm.
because of the resource development and installation specialty protocol that
Yeah.
was introduced, in the late 90s, early 2000s, primarily attributed to Andrew Leeds and Debbie Korn. And I want to be
Mhm.
very clear, what I am about to say is not intended to disparage their work, because I do
No.
think the RDI concept is probably the greatest update in the development of EMDR, to
Oh yeah.
recognize that we can broaden the scope of what is meant by resourcing, and that we can use this idea of slow bilateral stimulation to strengthen the connection, or slow dual attention
Right.
stimulus, as
That
it were.
targeted, that idea of
Yes.
targeted resourcing where necessary is beautiful. Yeah.
But I have never been a fan of the name resource development and installation. I like resource development. I like
Mhm.
resourcing, resource strengthening, but I do think the name and installation is where a lot of the confusion has come in, because then people will conflate, well, RDI, which is really mostly associated with phase 2, and then hear phase 5 installation and think, um, wait, so that mean we slow it down because it's positive? So I think that's why, as much as I love the RDI concept, I'm not a fan of the name. And I just mention the name in our training program,
Yeah.
and we'll say you're mostly going to hear me refer to it as resourcing or
Exactly.
resource strengthening, because I don't want to promote that confusion.
Exactly. And I think the key, if I, for me, it always goes back to what are we actually doing in the brain? And in phase 5, when information becomes adaptive, right? Adaptive isn't always positive. And I think that's the way that we have to look at what we're doing in phase 5.
Mm-hmm.
That it positive material may be there, but it's not necessarily about it being positive. It's about it being adaptive as it relates to the trauma memory and the response that the person was having about self and the world, physiologically and emotionally, about that event, right? And those experiences. And the coming to an adaptive response or an adaptive resolution
Mm-hmm.
isn't necessarily quote unquote a positive resource that you would then look at in preparation.
Yeah.
They're two totally different
Or
things.
in between sessions,
Or
let's
in
say,
between
for
sessions, or however,
anchoring
right,
safety.
right.
Yeah.
Mhm.
So here's a related question that I often get, and I would like your take on this, especially from the neuroscience perspective. Does it matter to distinguish slow from fast? Because I have some colleagues who don't make much of a difference, that tapping is tapping or eye movements are eye movements, and they'll use more of a faster speed in phase two.
Mhm.
So I'm curious how you would best explain why it is important we distinguish. Is it important that we distinguish?
Right. I think it's important we distinguish for two reasons. One is that slow bilateral stimulation is calming to the parasympathetic nervous system, right? And left, right, not only limbic up to prefrontal cortex, but also hemispheric left right motion
Mm-hmm.
actually helps create neuroconductivity between the left and right hemisphere, part of our parasympathetic system. And so slow bilaterals increase that effect, that response, right? Supported. Fast bilateral stimulation, right, is not necessarily encouraging. It can encourage conductivity, but it's not encouraging calming, right?
Mm-hmm.
What we're doing during the reprocessing phases isn't to calm the person. It's to
Mm-hmm.
activate them and maintain activation. It's
Mm-hmm.
like I activate you up and then I put a door stop,
Mm-hmm.
in the door so that the parasympathetic system doesn't then calm,
Mm-hmm.
the sympathetic system back down. So it is important that there's a distinction between fast and slow. The other piece of it is that yes, there is some research out there and that we know about that we've been that a lot of people talk about the mechanism of action around what's happening with EMDR.
Right.
We're in reprocessing, and yes, we know one of the mechanisms of action is the bilateral stimulation and the research around that. We do understand that one of the other mechanisms of action is the whole idea of the taxing working memory
Mm-hmm.
theory, and in that context, bilateral isn't significant. But what we do know about EMDR is that there's multiple mechanisms of action going on,
Mm-hmm.
right? One of them is working memory, which bilateral is not all that apparent or necessary. But the other one around the idea of REM sleep and the whole idea of what's happening in that part of the brain, fast is important when it comes to our
Mm-hmm.
sympathetic system.
Mm-hmm.
Yeah.
Yeah, good stuff. So yes, the short answer to review is you go fast in phase five, especially if you're in standard protocol. Now, two other issues to kind of to go to here. So obviously that would also mean phase six, body scan.
Yes.
You stay
Yes.
fast as well because it is a reprocessing phase. And this is where, I fully take responsibility for perhaps creating some of the confusion, in my writing that, when you come to closure, what do you do? Because there's
Right.
some people who really feel, BLS has no place at all in closure, that you're just bringing up the safe place, you're bringing up the container. But do some people need to go to slow bilateral during phase seven?
Right. And I think there's two parts to this. One is from body scanning into closure is this nondescript kind of very like just stylistic way that therapists move kind of body scanning,
Mhm.
phase 6 into phase 7 closure. It's not a okay, we're done, officially end our, and now we
Mhm.
are in closure. It's a very smooth transition. It's a therapy, not a technique. So it's very smooth. So
Yeah.
where did we end body scanning and begin our closure is kind of this grayness, and I think that's part of where people get confused. So with that, in closure, the slow bilateral itself, as we just described, is calming and soothing all by
Right.
itself because it activates our parasympathetic system, right?
Mhm.
It's why we rock infants. It's why we do all the things that we do, in slow bilaterals, taking a walk to
Mhm.
clear our mind, all of those things. So inside of the concept or the idea around doing that enclosure is fine because for some people the slow bilateral is the resource.
Yes,
It is
correct.
a resource. And for some people, they're all tapped out and they just want to use the skill that you did with them, right? No pun, right?
Mhm.
That you did with them and they just want to utilize the skill and don't want the slow bilateral with it. But I
Mhm.
think where it got confusing is that there's such a grayness when we're moving from 6 into 7 and then
Yes.
and then when we slowly then move into a slow tap at the end in closure is not what was happening in phase 6 body scanning. And I
Mhm.
think that that's one of the reasons why people get
And I know part of where because this idea of honoring transition is very important to me. And I can get concerned when we're like, go with that, go with that, go with that, go with that, all through 5 and 6, and all of a sudden we allow like 5 to 10 minutes for closure. And so even though I have been a big believer, like if you're watching this video, you've likely seen other demo videos of mine. I go fast. I mean, if a person can tolerate fast, I go fast, right? I do know, especially from having watched some of my demo work, that when I get into phase 5 and 6, I have a tendency to shorten up my sets. But this goes to the issue of, does anything magical happen at 36? Does anything magical happen at 24? Or is it something that you just kind of feel out? And one of the reasons I do tend to shorten up sets towards the end, but not go so short like we do in phase 2, is because it's like, all right, we're winding down. And so obviously I'm not going to go maybe as long as I would if a person's in the middle of an abreaction. So, I mean, I do think there is some room for clinical judgment. I think I'll just, kind of summarize it at that. But the key is when you're in phase 4, 5, and 6, you stay at processing speed.
Right.
So,
And just,
go ahead.
well, to back up on what you were just saying, though, I think the idea is the idea of us allowing for, like you said, that work as it's beginning to wind down. The idea is that like those connections are still being made. And so if connections are being made and more stuff's coming up, I would think that you would continue with your sets. But as less and less and less is coming up between the sets, you're starting to shorten them up a bit, not short, like foot two. You're shortening them up a bit because not as much is coming in. Longer sets because there's isn't as necessary. And I think that's really what you're doing.
And we could probably do another separate video in this series. Does anything magical happen at 36? But to wrap up this specific video, let me ask you, do you think another source of the confusion is some of the material out there with the specialty protocols we talk about now, or specialty strategies like EMD and recent events? You are way more skilled on this than I am, so I want you to chew on that a bit.
Yeah, and not to go into it a ton because we could do it later. But the idea is it's some of the modified protocols, the specialty protocols related to specific situations, specific type of like recent events or things like that. There are modified protocols that have different speeds of tapping, like a medium tap and things like that, that are to address specific things, like maybe a recent event or a single incident type thing. That inside of those modifications, there's changes in the speed of the stimulation. There's also other changes within whether or not you're getting different aspects of the whole entire activation sequence and how you're. So I think some of the confusion has come in where there's aspects that when somebody maybe is being trained in basic, and then they're also getting some of the maybe some of the modified protocol, and they're not sure which one's which, and then eloquently why. See, it's the why. And if you understand why you're doing it, then it makes complete sense as when you would do it medium versus if there's a slow in phase 2 versus fast during reprocessing or a modified protocol that changed it up for a different reason,
And I'm kind of smiling because my feeling on this: learn the standard protocol well first.
Right. And do the standard protocol, right? Do the standard protocol. Remember, and this could be another series that we talk about, modifications versus model drift. If you don't understand why you're modifying, if you do not understand why you're modifying, you're model drifting, and those are not the same thing.
So we have 2 new videos we can prepare. So stay tuned, my friends in the interwebs. Does anything magical happen at 24, at 36? And is it modification or model drift? Amber, always a pleasure talking to you. You have such a great way of helping me better understand a lot of these concepts. And stay tuned as more videos will follow in these technique EMDR questions.
Right.